And the next is Dr. Bileshwar Samanta. Please,
This side.
you can prepare yourself for the next podium. Yeah.
Okay, so good morning everyone. Thank you Dr. Samantha for providing me the opportunity. So I would be presenting a unique case, an unusual foreign body. So this was my reaction. My brain was like, what and how could this be possible? When I received this picture from a resident that a child has been brought to the emergency with such a foreign body. So this is the foreign body. You can see dangling from her eye up to the shoulder. So she was a 9 years old girl, a child of a laborer parents, and she was referred to us from somewhere. She had a history of fall on a pile of wires while playing, and on examination we could see there was a 16 centimeter long metallic wire, 2.5 millimeter in thickness, into the superior temporal fornix. And interesting is to know that the other end of the wire, which was on the shoulder, it has a hooked end. So since the child was very uncomfortable on the movements, as well as she could not move her head or neck, so we decided to cut it short before sending her for CT scan examination, and we cut it with the K wire. And so this CT scan imaging is showing a shorter segment wire. So you can see the axial imaging and the coronal image, and on the axial imaging it is interesting to know there are 2 points. So the 2-point reflectivity showed that it may be an hooked end which is inserted into the eye. So there was a metallic foreign body, 3.5 centimeter long with the width of 2.5 millimeter, lateral to the right eyeball. Luckily, she had no eyeball injury, no injury to any extraocular muscle or the optic nerve. And this body was partially in the orbit and partially outside the orbit. The bony walls of the orbit were intact with no fracture, and there was a mild periorbital soft tissue swelling. So we decided to explore it under GA and to remove under GA. So this is a short video. So we make a periotomy. We made a conjunctival incision around the foreign body. We fixed it with the help of an artery forceps, and with slight rotatory movement we tried to find out where the other end is inserted or it is impaled or hooked. So with little manipulation we could see the hooked end, the angled part of the foreign body. It is apparent now, so we tried to clear the conjunctiva around it. Now we can clearly see that end, and with the help of I just rotated it so that it becomes more obvious, and then we inserted and we placed another artery forceps just at that angle. You can see that the end is now coming out, and with another artery forceps and slight rotating movement, it was removed. We washed it and we sutured the conjunctiva. And this is the segment of the wire which was removed. And this is the first day picture of the child, happy child, full eye movements, no pain. Thank you.
It's good. Excellent.
What was the visual status post-op?
So she was good. She had she was 6 on
So
presentation.
the retrace the railroad method, the way it has gone inside has to come out that
Yes,
way.
yes,
Then
yes.
only it's
Yeah.
will-
Yes.
without causing.
Everything helped because it was an extraocular
Pardon?
injury.
Fish hook kind of thing.
The
Yes.